All righty. We will get started. Thank you everyone for joining us today for our All In for Kansas Kids, Strengthening Early Childhood in Kansas monthly webinar for June 14th, 2023. I have a few of my CPPR colleagues joining me today. We have Clayton Gerard, who will be doing Zoom logistics for us and dropping links in the chat when necessary. We're also joined by Chris Tilden, Rachel Gardner, and Megan Kluth, who will be our presenters for the day. And I am Julia Gruss, a research project specialist at the Center for Public Partnerships and Research at the University of Kansas, and I will be your webinar facilitator today. Just a few quick updates before I pass it off to our presenters. As always, we have our new monthly webinar schedule. Our next one will be on July 12th. And you can also sign up to receive our All In for Kansas Kids e-newsletter on the Children's Cabinet website. That will always update you on everything that's going on in Kansas. We have Chris Tilden today, who's going to be giving us an update on the needs assessment, as well as Rachel Gardner and Megan Kluth, who are going to be giving us an overview of the developmental health family engagement sessions. And then after they are all finished, I'll just give you a few early childhood systems updates. But without further ado, Chris, you can get started on that needs assessment overview.
Great, thank you, Julia. Thanks for the opportunity to talk today about the needs assessment. Hopefully you all can hear me okay. All right, well, I am probably going to cover a bit of history that most of you are familiar with, but also talk a little bit about where we are in the process with an update of the early childhood needs assessment. We have been working through preschool development grant funding over the last couple of years to develop a mechanism to document the challenges that face everyone that is part of the early childhood system, be that the providers, the children and families they serve, and many other system partners. And we obviously do that in order to inform the collective work that we're doing to improve the system. So we're really fortunate and excited about having an opportunity to go through this update. As you all know, the assessment done with initial PDG funding back in 2019 led to the development of our All In for Kansas Kids Early Childhood System Strategic Plan. And the goal of this effort is to look at the development of a new plan that will likely cover the next 5 years or so of our collective work together. So we're really excited to be part of this process. Next slide. Just a little background in terms of the overall timeline. Looking back historically at our work, as I mentioned, in 2019, Kansas received a preschool development planning grant. And as part of that work, the partners worked diligently to complete that first early childhood needs assessment that was completed in 2019 and first published in January 2020. As I noted, that then led to the development of the All In for Kansas Kids strategic plan that was envisioned to cover the period from about 2020 to 2024. So we received implementation funding from the Administration for Children and Families between 2020 and 2023. And as part of that process, in late 2020 and then again in 2021, we produced updates to those needs assessments. But we were excited and fortunate this year to receive a second PDG planning grant. That award, as you all know, was announced earlier this spring and gives us an opportunity to again, develop a new needs assessment document and use that to inform the development of a strategic plan. Next slide. So I wanted to highlight at least a few ways that I believe this planning process will be a bit different than where we were in 2019. And I think the first thing to note is that we envision that specifically for the development of the needs assessment, we envision kind of a less structured series of meetings, of surveys, of other data collection processes. You know, if you think back to 2019, we've talked a lot about how we talked to over 6,000 Kansans. You know, we had meetings around the state. There was a lot of input that was received through that process, specifically to gather information from the needs assessment. And it's certainly not that we value that perspective and input from the state, but I think we're just in a very different place than we were in 2019. And there's a lot of ongoing activity of that sort that we really feel can inform the development of the needs assessment. So I suspect that I've talked to a number of you and will continue to talk to you, as will other members of the team, but you probably won't receive a needs assessment 2023 survey from us. You know, we've got a lot of rich data from a variety of assessments. I think specifically, and in part because of the COVID-19 pandemic, you know, we really made efforts to try to understand what was the initial and then the long-term impact of the pandemic and what kind of stressors did it place on the system. So we've got a lot of rich data there. I think we're also kind of in a different place just in terms of structure. If you think back to the childhood governance structure, you know, that was created as part of that needs assessment and planning process. We did not have that structure in place when we began this work back in 2019. We also have things in place like the Data Governance Board. We have a whole system of efforts that are working on things like the Workforce Registry and others that it'd be a long laundry list if I was to list all of those here. You know, we were very proud of the sense making and the stories that we collected from across the state. Again, we're not planning to undergo a specific needs assessment or tomorrow's project or other type of sense making, but there's a lot of systemic and ongoing community sense making efforts that we feel will inform this process. And then one of the things that's very different is that early this year, as we know, the Early Childhood Transition Task Force began its work. So there is a very systematic process in place looking at the early childhood system in Kansas and how the statewide system can support that. In addition to that, you know, a host of other partnerships that really put us in a different space. Next slide. Just wanted to highlight a little bit, like emphasize, I guess, some of those points. And if we can advance one more slide. I don't know, I don't see it advancing, but if not, that's fine. I wanted to speak to some of these points in a little more detail. You know, because when I speak to lots of data, there, you know, some examples of some of that work, things like we've done an extensive assessment of many of the programs that are part of the mixed delivery system over the last couple of years in concert with all of the state partners, and that's very rich data that speaks to where we, you know, as a system are in a lot of this work. And there are a lot of issues that, in addition to, oh, there we go. Magically, the slides are moving again. I just literally pulled out a couple of data points that I thought spoke to And the numbers aren't important because I know these are small numbers, but on the right, speaking to the number of Kansas families with kids in poverty, one of the findings of the last needs assessment was that there's a lot of disparities in outcomes. And those disparities are based on factors like education, income, and where you live in the state. And we also know that from an economic perspective, particularly with the pandemic, there have been real pressures upon the providers that are part of the mixed delivery system. So on the left, you have an estimated revenue and expenses of a medium-sized childcare facility in our state. Obviously, we believe that the existing payment model is one that really needs reform because at this point, the average revenues are less than the expenses to operate these facilities. While at the same time, in that middle graph, you look at providers and they are reporting, challenges in terms of ability to pay bills on a month-to-month basis. Next slide. I thought that this was a real powerful graph that speaks to why this is an issue, not just for those of us sitting around the virtual table today who are interested in the quality of childcare and other child supports in the state, but what does the economic impact of that look? The Bipartisan Policy Center put together this estimate. Each of these points is a state, and it looks at the number of childcare gaps, which as you go towards the right is a higher number, and its relationship to the estimated economic impact on that state. And this is one that, if you look at those just remarkable numbers, the estimated economic impact in Kansas of the childcare slots that we need in order to fulfill the needs of families. At a low end, that estimated economic impact is over $2 billion, and at a high end, closer to $3.5 billion annually. I mean, this is something that's impacting all of us at a variety of levels, including the economic wellness of our state. Next slide. I mentioned that there are a lot of parent, public, family engagement efforts underway. And these, again, just a handful of examples. Next, you're going to hear from Rachel and Megan, who oversaw discussions, virtual family engagement sessions this spring, focusing on early childhood development in our ASQ system. Earlier this year, we completed several needs assessments like the McVie needs assessment. The document here in the middle was an interim assessment of the maternal and child health program that was done again to get a gauge for the impact of the pandemic on that program. And another exercise this spring with the Kansas Association for Infant Mental Health. How most of us have a busy refrigerator that if you look at that refrigerator, it gives you a snapshot of your life, the things you have to do, the pictures of individuals that mean something to you, a kind of a snapshot, artifacts that give you a picture of what your life looks like. They went through an exercise to talk about, so what does the refrigerator of our system look like, and what do we want the refrigerator of that future to look like? What are those artifacts that we would envision in a healthy early childhood system in the future? So there are a number of ongoing public and family engagement efforts, of which these are just a few examples. Next slide, please. As I mentioned, we have a robust structure in place. I would guess, and again, most of you have probably seen these before, so that early childhood governance structure, you all have seen it. It's probably too small to read most of those work groups or advisory councils that are part of that effort. But we have a lot of partners engaged in work, and many of you are participating in those efforts to develop this system through this governance structure. And there have been some new structures developed through this process, one of which is the Early Childhood Data Trust that is working to look at how do we ensure that we can build a system where we've got adequate data to understand the impacts on children and families. How is it that we can, through the lens of children and families, understand their impacts by creating an early childhood integrated data system, which is very much the focus of the data trust at this moment. Next slide, please. And as I also mentioned, if you have not had an opportunity yet, these meetings are open to the public, and I think we're approaching meeting 3 at this point. But the first executive order from the governor's office in her second term early this year was to create a Kansas Early Childhood Transition Task Force. That task force is being led by the Hunt Institute out of North Carolina. And we are very much, following the work of the task force, communicating with the task force leadership. And many of you are I can see people on this call that are sitting on that task force who are ensuring that as we move forward and develop needs assessment, that's being done in a way that's synergistic with the work of this task force that plans by the end of the year to make recommendations to the governor and to the legislature on the statewide structure of the early childhood system. So obviously really key and important work that is super important to these efforts that we are engaged in. Next slide. So just a little on the kind of the timing of the process itself. As I said, we've been collecting all of the various reports, data that's available to us that has been collected and published over the last year. We envision continuing to collect that data, synthesize that data through the summer. As I noted, there isn't a lot of kind of primary data collection or new data collection that will occur, but there are some things that we've decided we really do want to take a little more in-depth look at. And so, for example, we're working with Child Care Aware and trying to identify providers of childcare facilities that closed. And we're hoping to talk both with facilities that closed and then felt conditions were such that they were not able to reopen, and also talk with facilities that at some point in time after the pandemic decided that they were in a position to reopen and understand some of the dynamics. What were some of the pressures involved? What were some of the key resources for those that did decide to reopen? What made that decision easier? What were the supports that they needed to have and felt like they had in place? So we will be doing some kind of primary data collection like that, again, with our intent to try to complete that exercise late summer of 2023. We'll begin the synthesis of all of that information in the summer and fall with the goal of having a report drafted in the fall of 2023. That will be shared widely. I'm sure we will come back and talk about the kind of the key findings, the key assumptions, key recommendations in the needs assessment to inform the development of the strategic plan, later this year. We envision that late in 2023, this document will be shared with the state director's team, shared with the Children's Cabinet and Trust Fund, and with ratification of that plan, move in late 2023 into an exercise to utilize that information and build our next strategic plan. So really looking forward to being part of that process. I'm probably at about time, so I think this is the last of my slides. So I'm happy to stand for any questions, or if anyone has additional insights. I see a number of you online that have been part of this process on an ongoing basis. And so this is kind of the needs assessment through the lens of one individual from CPPR who's helping coordinate the effort, but would love to hear from others that have been involved in the work and have some additional perspectives as well. Thanks, Julia.
Thank you so much, Chris. I'm not seeing any questions in the chat right now, but if anything pops up, we will let you know. So sorry to everybody for that technology hiccup we had. Luckily, Clayton was standing by with the slides to come back in. My Zoom decided it wanted to shut down on me. So next, we're going to have Rachel Gardner and Megan Kluth, who are going to discuss our developmental health family engagement sessions that will be and have informed the needs assessment. So I believe Rachel is going to start us off, and then Megan's going to join in about halfway through. Go ahead, Rachel.
Yeah, thanks, Julia. And hopefully my Zoom stays up and working as well. So good afternoon. My name is Rachel Gardner. I'm a research project coordinator at KU CPPR. And I also have with me Megan Kluth, if she'd like to introduce herself too real quick.
Good afternoon, everyone. I'm Megan Kluth. I'm a research project manager at CPPR, and I'm excited to share some of what we've been up to today.
Yeah, thanks, Megan. So Megan and I are here today to share about the developmental health family engagement sessions, to provide just a little back history on how these came to be. In the fall of 2022, as part of the All In for Kansas Kids strategic plan implementation efforts, CPPR conducted a survey to learn how Kansans understood the topic of early childhood developmental health, the screening process, and what resources were available to them. There were nearly 1,500 families and providers across the state that participated in that survey. And the results from that survey were collected kind of as a first step to create improvements to existing awareness efforts that were happening and to prioritize new initiatives and education. 3 themes emerged from that feedback, which included kind of gaps in awareness for developmental health milestones and screenings, family overwhelm in trying to navigate the system, access timely information, and then identifying who to trust for those supports that would also be culturally responsive for families. These themes really helped support the next step of the virtual developmental health family engagement sessions that were just held this spring of 2023. So the purpose of those family engagement sessions was to really elevate parent voice, to increase knowledge and developmental health, and for parents and caregivers to work together to generate some small actionable solutions to improve developmental health experience for families across Kansas. Next slide, please. Some of the highlights from those sessions included that all regions of Kansas were represented in a series of 6 independent virtual sessions. 5 sessions were facilitated in English. 1 of those sessions was facilitated in Spanish, and then there were 93 participants total. Many ideas were generated over the course of these sessions, and these potential actionable solutions were compiled and categorized to help create their post-session survey, where participants voted what was most impactful and what they thought would be least impactful for solutions. The participants commented that they commented a lot, and they were really encouraging, and some of their feedback was really empowering. And there was a lot of interest in continued involvement in the family voice piece. So the follow-up survey was organized then, those results in 3 themes from the 6 sessions. And the first theme included solutions that were technology focused. Next slide, please. So top solutions that parents and caregivers chose were a centralized online website or parent hub, kind of a one-stop shop in a virtual space to help eliminate that struggle of having to navigate different sites, being able to access those resources in a timely fashion. And then that would also contain those trustworthy information and resources from reliable sources. The second one was an app to create instant access to local developmental health resources and information. And then a potential opt-in text service for reminders for developmental health screenings or other information such as milestones or even physician visits. Next slide. The second theme that surfaced from those results was improving the process of accessing developmental health information as a whole. Some of the top solutions included family resource kits. So these would be kits that have age-appropriate tools or toys that families could use in their home to support the developmental growth patterns of their children. Increased public awareness of screenings, the importance of screenings, and then what is the available local access. And then to create and support coordination between the prenatal, postnatal care and pediatrics, just really bridging that gap and emphasizing the importance of developmental health and screenings. And finally, the last theme was connection. And the top ways that they wanted to get connected and stay connected included local opportunities to learn from experts in the early childhood and developmental health fields, increase awareness around in-home supports such as home visiting, and then virtual supports that parents and caregivers could access at any time, such as pre-recordings with providers and professionals that they could watch at any time, online learning centers with access to free materials, books, pamphlets, learning materials, or even simple solutions such as a QR fob, where they could just access it while they were playing with their kids or sitting in a doctor's office. They can pull it up on their phone and just have those supports and materials while they were on the go. So I'm going to turn it over to Megan to kind of share a little more about what the parents had to say.
Yeah, so thank you, Rachel. Rachel mentioned that we had some just incredible engagement throughout these sessions, and we wanted to share a few of the quotes that came from the parents and caregivers who participated in this. And it really was quite wonderful to see the level of engagement that they had, both during the sessions, but as part of the follow-up. And one in particular that I want to share, because I think this was expressed a lot, and I think something that probably many of us have heard from families that I think is worth highlighting is Toward the bottom one is, although I felt nervous about not being, in quotes, smart enough as a parent with some of my answers, I appreciated that the safe space was created. And we really tried to, I mean, we know that parents and families are the experts on their children. And so we really tried to keep that theme throughout. And it was really, it was a little disheartening, I think, to hear comments like that in the beginning, but it was also very positive to hear families say, like, I felt very valued in what I was saying, and like my experience was being heard. We also had a lot of comments about just the benefit of hearing from other parents' experience and reducing the loneliness and isolation of maybe I'm the only one with that question, or maybe I'm the only one having that challenge. I think it just very much normalized that although it's a different experience for each family and their child or children's developmental health needs, you know, there were some families that had really positive experiences, and there were some families that had some pretty significant challenges with access and navigation. And so I think people got a sense from across the state with, you know, very different family demographics that this is not necessarily an easy or linear journey for a lot of people. So hopefully these quotes kind of highlight that. And again, like it was really wonderful to see the number of parents that directly reached out and said, I really want to stay engaged with this work, whatever that looks like. So we are trying to be very thoughtful about how to how to offer those opportunities for families. Next slide. So I'm sharing, I know there's a lot happening on your screen. I'm sharing a quick snapshot of, we had 2 graphic recordings that were done by Sarah O'Keefe on our team at CPPR. And Sarah attended the sessions, and both all the English and the fully Spanish session, and really tried to capture, there was so much information shared, so many wonderful experiences and ideas. And so this is an effort to try to kind of synthesize this in a fun visual way. And these have both the English and Spanish recording have been shared with the families. And they also have just went live on the All In for Kansas Kids website, as well as kind of an overview of these sessions. And I think Rachel's going to put that link in the chat here in just a minute so you can see it. And we will continue to put updates on that All In for Kansas Kids page. We committed to the families and want to make the commitment to you all as partners that, you know, even though we kind of helped facilitate these sessions, we really want this to be very open information for people so that we can all learn from them and all think about how we can improve developmental health experiences for families. So I would really encourage you to pull that, pull the link up when Rachel puts it in the chat and actually take a look at some of these, because I think families shared a lot of experiences that I think maybe we had heard, and quite a few that we hadn't. And so I think this is an amazing synthesis of hours of conversation that I think can benefit all of us in our work. Right, next slide. And then this is the Spanish version as well. And we're really trying to be very intentional about continuing to offer the follow-up information in both languages. So it was exciting to be able to offer a fully Spanish session, and definitely something we'd like to continue doing. All right. Okay, as Rachel mentioned, there was not a lack of ideas and not a lack of solutions. And I think we at CPPR are kind of trying to figure out how can we share those. We don't want to be the gatekeeper of that information. There's so much information shared that I think could be tested and implemented, across the board at the local level, potentially at statewide levels. And so we are starting to have some conversations with partners. So you may be hearing from us about like, what could this look like? How could we try some of this? And we're really trying to take like, what's sort of the like bite-sized approach? What is a good thing for us to try? And so I would encourage you, if you're interested in learning more about any of these ideas, or kind of saying, sounds really interesting, I don't even know where to start, but I think my community could use this, reach out to Rachel. We're happy to have that conversation with you. Again, I think we really want to encourage people to use this information and think about how to put a local spin on it. You all know your areas better than we do. So there's a lot of ideas that I think could be developed in a variety of ways. And even if it feels like a small start. And we certainly saw people talking about, oh, it'd be so great if, like, I know this region of the state has something, it'd be so great if my region had something. So I think we're all trying to solve similar problems when it comes to improving developmental health experiences and outcomes for families. And we hope that what we've learned from these sessions can be a resource for you as you're thinking about how to plug any of this into your work. But we also want to be a resource, and also we want to know what you're doing so we can highlight it. So if you're doing really amazing things in developmental health and we can help promote it on the All In for Kansas Kids website, or even on these webinars, please let us know, because we know there is probably way more amazing work going on across the state than any of us can possibly keep track of. So really want to celebrate the work that's being done and continue conversations about how we can make it even better together. Okay, that is all we have. At this point, we'll open it up and see if anybody has any questions.
We might just have a quiet group again today. I'm not seeing anything coming up in the chat. I did just get a question about how we subscribe to the newsletter. Jaquita, at the end of the slides, my colleague Clayton will drop the link in the chat for the All In for Kansas Kids website. That will bring you right to the page where you can subscribe for that weekly e-newsletter. Alrighty. Yep. Clayton, if you want to advance to the next slide, big thank you to Chris, Rachel, and Megan for their updates on our needs assessment and those developmental health sessions. I'm going to give us just a couple of the systems updates here. Community engagement, we have the task force community engagement tour happening. Share your experience at a session near you. Governor Kelly's Early Childhood Transition Task Force announced plans this week to conduct a community engagement tour to discuss the challenges communities face in supporting children throughout their earliest years. Expanding access to early childhood care and education is vital to the success of our cities, towns, and communities. We want to hear from you about how the state can be a better partner in your efforts to address all childcare issues. Join the Early Childhood Transition Task Force at an upcoming regional meeting to share your experience. And for additional information, including full location details about this tour, you can visit the governor's website. That link will be placed into the chat in just a moment, and we can move on to the next slide. All right, a funding opportunity. Did you know that Child Care Aware of Kansas is working to establish a shared services network for licensed Kansas child care programs? Shared service networks offer child care providers the opportunity to strengthen their business practice while focusing on what is most important, the children. This approach is flexible and customizable, and it's most successful when tailored to a provider's specific needs. I'm going to share a quote from Louise Stoney, who is a co-founder of the Opportunities Exchange and is an independent consultant specializing in early care and education. This will give you a better idea of what shared services is. At its core, shared services is a simple idea. Organizations can reduce costs and improve the strength of management and the quality of services by sharing administrative functions with other organizations that provide the same types of services. By joining forces, programs are able to stay small, preserving intimacy, which we know is important to families, while also able to improve long-term financial strength and management capacity and the ability to provide a high-quality service. So all of this starts with a hub. And a hub is either a single organization or collaborating organizations that act as the hub of operations for one or more new early care and education services, shared service networks in Kansas. The hubs will have the responsibility of managing provider-driven services to a group of childcare programs. These entities are often based locally, serving a network of providers in the same community or region. You can fill out a request for applications form to become a hub. And Child Care Aware of Kansas anticipates funding awards of up to $250,000 per organization. You can learn more about this opportunity and the benefits of shared services at the Child Care Aware of Kansas website. And that request for applications is now available, and those will be due on June 23rd. So the Child Care Aware of Kansas website link will be put in the chat, as well as a link to that request for applications, the RFA. Go ahead on to the next slide, Clayton. Thank you. All right, focus group opportunity. Family focus group is happening. If you have recently received healthcare coordination during a pregnancy or after childbirth in Kansas, we want to hear from you. You are invited to participate in a virtual focus group to improve care coordination services. This focus group is led by the Kansas Department of Health and Environment and Kansas Health Institute. A link is going to be placed in the chat on where you can register to provide your feedback, and $25 gift cards will be mailed to all focus group participants. If this opportunity does not apply to you personally, we ask that you still share this with anyone you know who has recently had a pregnancy or given birth in the state of Kansas, so that they can share their experiences with us. So again, the registration link to provide that feedback will be placed into the chat. And we can go to the next slide. Reminders and next steps. Here are our upcoming meetings. Our early childhood recommendations panel meeting is this Friday, June 16th from 9 to 11:30 a.m. This meeting is live streamed on the Children's Cabinet YouTube page. We will share that link as well shortly. The Children's Cabinet meeting is there's a special meeting on Friday, June 23rd, and this is where they are going to approve the Child Care Capacity Accelerator grants. And then our next Early Childhood Systems Building webinar will be held on Wednesday, July 12th from 12 to 1 p.m. Again, you can find all of these meetings and more on our Children's Cabinet YouTube channel. And as always, please feel free to share with us your ideas for these webinars. If you have anything that you would like us to talk about, anything that you would want us to share at these meetings, I've gone ahead and put my email in the chat. You can email me. We would greatly appreciate it. We're always looking for new ideas and we want to hear from you. Go ahead to the next slide. That's it. That's a wrap for today. You can stay up to date by, again, signing up for our weekly All In for Kansas Kids e-newsletter. You can follow us on Twitter, and you can go ahead and subscribe to our Kansas Children's Cabinet YouTube channel. But with that, we are all done. I'm going to give you 15 minutes back in your day, and I hope everyone has a wonderful rest of the week. Thank you so much for joining us.